let me to start my presentation on patient is a human being. Patient is a human being. Outline of this presentation. First, we'll see what is humane care. And this audience is nurses who are physically participate, and also most of them virtually participate this symposium. And so I will try to talk who is a patient to healthcare worker, or who is patient to a nurse. And then we'll discuss who is a nurse to a patient, and what is the relationship between the patient and us, and between patient and healthcare worker, and what are the myths in local practice. And finally, I will discuss and take home message. So what is humane care? What is humane care? This very, very important concept, and Sri Lanka College of Internal Medicine always trying to emphasize this concept and bringing this concept to bedside. So bringing humaneness to bedside and be a human being to another person, another human being, is humane care. So we have to practice. When you do our day-to-day practice, always we try to apply this concept, humane care. Who is a patient to a nurse? Who is a patient to a nurse? We all know a patient with an illness who is receiving medical care is a patient. Person with an illness who is receiving medical care is a patient. But we have to discuss more detail about who is patient. So in Latin verb, pati meaning to suffer. So patient means someone who is suffering. So then I can say patient is a person who is suffering from illness, disease, and pathology. Also he is suffering from pain. Also he has fears and anxiety. Patient has a lot of social problems as well as a lot of financial issues. Also patient has ideas, concerns, and expectations. Don't forget this. All patients that we may forget. So all patients has their own ideas, concerns, and expectations. And also they know what is the disease, what we are going to do sometimes. So they have knowledge and experiences on their illnesses. So let me just tell a few words about what is fear, anxiety, and doubt patient has. So practice of medicine involves investigation and treatment of physical and mental conditions that are often fraught with fear, anxiety, and doubt. You know, if I am a patient, if you are a patient, when you go to the hospital for medical care, we have a fear, we have an anxiety and any doubt. What is going to happen? Whether this treatment is satisfactory, what sort of investigations we are doing. So that is very, very important. So, you know, on the other hand, many life-saving decisions are made in the face of uncertainty. We are practicing, in especially our country, we are practicing in most of places, resource limited setting. So many life-saving decisions are made in the face of uncertainty. You know it, especially in the emergency department, right? So fear and anxiety of patient is due to their illness. And they have fear and anxiety. What is the outcome? What is the prognosis of disease patient has? And what are the investigations we are going to do? And the system, the medical system, patient is giving care. I will ask this question from you all in this audience. Are patients afraid of the health staff? What is the answer? Of course, yes. So patients are afraid of the health staff. Why? Why patients are afraid? So that is very, very important. So if you further elaborate, we can say patient has fear and anxiety about their illness, outcome or prognosis of the disease, and what are the investigations we are going to do, and the system involved for the management, and about the staff. So they have fear and anxiety. So do patients have knowledge about their illness? What do you say? Generally, we are using internet, updating knowledge. Generally, patients have some sort of knowledge about their illness. Right? I will give a good example. This is this clinical scenario. You can see there's a patient admitted to our hospital, a lady coming with swollen face, swollen lips, and she's having difficulty in breathing. So patient is having swollen face and allergic sort of symptoms, and he's dyspneic. And our medical officers, house officers know this could be an allergic reaction. But she asked, doctor, please give me FFP. Patient asks, give me FFP. But we worried about that. Sometimes doctors worry, why FFP for this patient? If doctor or medical person don't know about this condition, he is wondering why you are asking FFP for this patient. But if you know about the disease, yes, may be useful. Then common thing, treated with hydrocortisone, adrenaline and piriton and so on, patient was arrested. And patient passed away despite of resuscitation. Don't forget, at the beginning, patient asked, please doctor, give me FFP. So why he asked FFP? Because patient know, I have some rare disease. He know, because previously he admitted to the hospital investigator. That's why he asked. So this is a rare disease. You know, C1 esterase inhibitor deficiency causing hereditary angioedema. Patient has knowledge about his disease. That's why he asked. But when patient admitted to the hospital, we didn't consider what is her request. Right? Can it happen? Yes, that's why I try to emphasize here what patient is telling, please listen. Right? Because sometimes we can save this patient's life if you start FFP. Patient already asked. Is it clear? Right. So that I try to emphasize here, patients has knowledge about their diseases. Right? So that is very important. Right? So who is patient now? So in this concept, so patient is not a person only with disease. They have a lot of requests. So just see what this spiritual leader, Dalai Lama, told. He said, whether we like it or not, we have all been born into this world as part of one great human family. One great human family. Not like divide doctors, nurses, patients like that. So we all in a great human family. If you forget this, we may miss this humane care. So one of the very interesting statement given by the spiritual leader, Dalai Lama. So a health professional needs to respect his patient. Respect your patient, right? He needs to understand, healthcare worker needs to understand that in front of him there is another human being who has opinions, point of view and feelings. So very, very important concept. Most of the time, busy situation, we miss it, right? So let me to say who is patient. So patient is not a person with an illness alone. So patient is a fellow human being. Fellow human being. He is a human being like doctor or healthcare worker or nurse, right? And who suffer from not only illness, disease and pathology. That's what we considered earlier. So he is suffering from illness, disease, pathology. Not only that, he is suffering with pain, fears and anxiety I discussed, and he has social problems, he has financial issues. Also, patient has ideas, concern and expectations. Right? Please listen patient what they are telling, and who has knowledge and experience on his illness. I show you a very good example. Right? So they have knowledge. Right? So let me to say what Sir William Osler said. I think this audience know who is William Osler. William Osler is a father of modern medicine. And he said, the good physician treats the disease, the great physician cares the patient who has the disease. Can you understand what is the difference? So great physician care the patient, good physician treat. So we'll see what is treating and caring. So great physician care your patient, their patient. Right, what is treating, what is caring? Treating is you treat, you give, manage, you give medicine or treatment for the patient. That is illness, treat for the illness. But caring is different. You have a person, you have a patient, and you give, you provide what is necessary for the health, welfare, maintenance, protection, and someone who need. Is it clear the difference between treatment and caring? So that's what we need, right? We do treating, but we need caring our patient. So then let me say, who is a nurse to a patient? Who is a healthcare worker to a patient? There are a lot of articles discussing this concept, and so what do patients expect from their nurses? When patients come to your hospitals, into your ward, your clinics, what is the basic request from the patient, from you as healthcare worker, as a nurse? So they think we are listening to their worries, right? We have to listen what they worry about. And also we have to educate them on their condition, just rather than telling you have this and discharge. So your duty, when you work in ward, patients ask, they have doubt, they have fear. So explain what is this condition. You have good knowledge. And also, they expect, patients accept the healthcare worker or nurse relieve their pain. So these are research data showing what patients expect from healthcare workers or nurses or doctors, right? So that's very important for us. So how can you apply this practice? So for you to guide them, you need to be empathic and compassionate. What is empathy and what is compassionate? Empathy is simply, I can say, the feeling, and compassion is my help. So my two colleagues will discuss what is empathy and compassion in next two lectures. Then relationship with the patient. Relationship with the patient, right? How can you make relationship with the patient? It could be factual or more formal relationship, or it could be humane or personal relationship. What we need, if you want to do good practice, good day-to-day practice, what we need, it could be humane or personal relationship. So what is formal relationship? What is formal? So basically, this is a legal contact between two parties, patient and healthcare workers, which jeopardize the prioritization of the patient's interest. We concentrated only one area. We are not always thinking what is the patient's interest, right? Then it implies defensiveness. Mostly we practice in Western countries. So mostly implies the healthcare workers' defensiveness. So what is the humane or personal relationship? So that is very, very important, this comment. It adopts an existentialist commitment while respecting the patient's unique concept, and enabling autonomous decision making and making autonomous decision making. So what is the relationship you practice first at the bedside when patients are in the ward? So it should be human to human relationship as well as nurse to patient relationship. Right, we'll see. So what is human to human? First one once you have seen patient, it could be human to human relationship. Your patient is a human being. So you accept your patient, smile with your patient and greeting. So those are the very important thing. Say good morning and like that. So you have to accept your patient. So this is very important concept when you practice in the ward. And at the same level, both are human beings, right? So that is very important when you practice this concept. And also show the respect you have for your fellow human being. You have to show he is a fellow human being at same level. So then we can very practice this as more humane way. And then you can continue your nurse-patient relationship and you can provide your nursing care for the patient. Right. So myths in local practice. Our patients are helpless. Our patients helpless. Leddu asaranada. Asarana leddu. What is your answer? Asarana is leddu. That's what we say. But patients come to hospitals of Sri Lanka, we have a lot of facilities. But we have limited resources, but we have facilities. But many people say, patients are helpless. Why these patients are helpless? We should allow to this happen again and again. No, patients should not be helpless, right? So this is due to huge gap between us and patients. So how can you reduce it? If you practice medicine in humane way, so if you provide humane care, we can reduce this gap. And this is the take-home message I want to say. Patient is a fellow human being. Patient is a fellow human being. And patients have so many sufferers other than a pathology and illness. Not only the illness, they are coming to the hospital, they are coming to the clinics. So they have so many other things we have to discuss. We have to listen to the patient, right? That's I discussed with few slides earlier. And we need to care our fellow human beings with the illness, not treating the illness alone. We should care our patient. And this should be practiced by applying empathic and compassionate manner. My colleagues will discuss in 2 lectures what is empathy and what is compassionate manner. And we should prioritize their needs, not our needs. We should prioritize patients' needs first. If you practice like that, that is the more humane way. So we can make medicine care more human then. Okay, so thank you very much. And actually, I would like to thank our president, SLCIM, Dr. Krishanta and Professor Saroj Jaisingh and Dr. Ganaka Senaratna, who are leading and trying to implement this concept and trying to get this concept at bed level. So, thank you very much.